The Matt Allen Show. News Talk 99.7 FM and AM 630 WPRO.
124 here in the Matt Allen Show. I just laid out this whole the absurdity of this idea that now we have a state university, URIs, we're going to require vaccination, proof of vaccination before anybody can go back to campus in the fall. But at the same time, they're not going to require the staff. They're strongly suggesting that the staff, so the people who are at the highest risk don't have to prove themselves. But the youngest people who are basically, very low risk, let's put it that way, who would still, by the way, have the opportunity to get vaccinated, are going to be required. And it's going to be forced on them as a consequence of wanting to get an education. That is, at the very least, a terrible way to treat adults who are supposed to be training to be adults. And it's at the most, it's just another this authoritarian streak that runs through academia is grotesque. Dr. Andrew Bostom's dialed in on this issue. Dr. Bostom, how are you?
Good, Matt. I was just reading the announcement yesterday when URI came out with their announcement, and one line really grabbed me because this is gotten used to seeing these things come out, so I'm kind of inured to it, but this one had a new wrinkle. It says, quote, proof of vaccination will also be required for anyone with a prior diagnosis of COVID-19. In other words, Matt, they're preempting what would be a entirely legitimate medical exemption for two reasons. First of all, the data are now clear, Matt. It's burgeoning. Even the World Health Organization recently issued a statement acknowledging the potency of natural immunity to SARS-CoV-2. But the real lab data pouring out are just very, very consistent. Whether it's laboratory evidence of particularly T-cell immunity, antibody-mediated immunity in people who've had natural infections, and then all the observational data, not just Israel, but countries across the world, all different ethnicities, lots of them done in healthcare workers, where a lot of this is studied carefully, that once they're infected, their reinfection rates are extraordinarily low, their morbidity is almost zero, and it's at least as good as vaccination. So to say this in a college statement, and the other problem is, Matt, it's a double-edged sword for these universities. It's anti-scientific in terms of the immunity conferred by natural infection versus vaccine, but there's a liability that they're potentially putting themselves, pitting themselves against. It's now apparent, at least in a couple of studies that have looked at this specific issue, both of them that I've seen came out of the UK, that when you vaccinate someone who's been previously infected, you increase the rate not only of relatively mild symptoms, post-vaccination, you increase potentially the rate of severe symptoms, including hospitalization. So, while universities may be willing for kids who have been previously ill and then get vaccinated, to get sick and they didn't wind up in the hospital. If some of these kids wind up in the hospital or are really ill and go to the emergency room, they may be potentially liable for this.